The phrase Medicare Replacement Plan is another name for Medicare Advantage plans. In fact, this phrase is most commonly used by medical providers when referring to Advantage plans because that's the way that they and often their staff think of them. Are you curious to know why? Hi there, if we haven't met yet, I'm Danielle Kunkel-Roberts, co-founder here at Boomer Benefits, and in this video I'll explain why medical providers use this term and also discuss whether you are really replacing your Medicare. Be sure to subscribe to our channel and stay tuned because I'll be sharing some very important information later in the video on how and when you can enroll in or change these plans. Okay, so let's look at an example. Lucy is a Medicare beneficiary considering her plan options, and she calls her doctor's office to find out which plans he accepts. The doctor's billing staff tells her that they take original Medicare and any Medicare supplement, but they don't participate in any of the Medicare replacement plans. What in the world do they mean? Here's the reason why doctors' offices often refer to Medicare Advantage plans as Medicare replacement plans. When you enroll in a Medicare Advantage plan, you are formally telling Medicare that until December 31st, you're choosing to get your Part A and B benefits through a Medicare Advantage plan instead of through original Medicare. For that reason, in the world of healthcare providers, they sometimes call these Medicare replacement plans, which results in a lot of confusion for beneficiaries like you. Although it feels like you are replacing your original Medicare when you sign up for a Medicare Advantage plan, it's really important to understand that it doesn't mean that you are permanently disenrolling from or replacing Medicare. First of all, you must be enrolled in Parts A and B before you can even enroll in a Medicare Advantage plan in the first place. So let's be clear that you aren't dropping Medicare. And second, though you will get your benefits from that Medicare Advantage plan for the rest of the calendar year, you will always have the option to return to original Medicare during a valid election period, such as the annual election period in the fall. What you are doing is just agreeing to be part of the Medicare Advantage plan for now. And here's how that works. When you sign up for an Advantage plan, you are essentially agreeing to use the plan's network of doctors and hospitals when you are getting your health care in most circumstances. Likewise, your providers will send their invoices for your care to the Medicare Advantage insurance company instead of billing original Medicare. So if your doctor says he doesn't take any replacement plans, that just means that he's not in the network for any Medicare Advantage plans in your area. It's important that you don't enroll in a plan that your preferred providers do not accept if you want to keep seeing those doctors, hospitals, specialists. Now, you may be wondering why Medicare would have created these plans in the first place. The Medicare Advantage program was created in the late 90s to give beneficiaries another option besides just original Medicare and a Medigap plan. After all, some people simply cannot afford Medigap plan premiums, so these Medicare Advantage plans give them an alternative. It's a way that people can get their benefits from a private plan instead of Medicare. Now again, you must still be enrolled in both Medicare Parts A and B when you join an Advantage plan. You will continue to pay your regular monthly Part B premiums the entire time that you are enrolled in the plan. However, Medicare Advantage plans often have lower premiums than traditional Medicare supplements, which are also called Medigap. The reason that Advantage plans can offer you lower premiums is because they'll provide a network of healthcare providers for you to seek your care from. They can negotiate contracted rates with these providers, which gives the insurance company better control over what it spends on your medical care. Now, in an HMO-style Advantage plan, you usually will choose a primary care provider and need to get referrals from that provider in order to see specialists. You cannot treat outside the plan's network at all, except in cases of emergencies. In a PPO-style plan, you can treat with providers who are not in the network, but you'll pay higher costs to do so. You must also confirm that the out-of-network provider is willing to bill your plan for those services. You may be wondering why you would still have to pay your Part B premium when you're enrolling in an Advantage plan that may also have its own premium. And the reason for that is that when you enroll in a Medicare Advantage plan, Medicare pays that insurance company a hefty monthly fee to handle your claims and pay out any benefits necessary. So your Part B premiums are going toward helping Medicare cover a small portion of the cost that it pays to the insurance company to take you on as a member and pay your claims. The Advantage plan must offer you all of the same original Medicare Part A and B services that you would normally get from original Medicare too. They cannot leave anything out. However, the plan's underwriters are the ones who will make your coverage determinations instead of Medicare. Since there's a network, some procedures or services may require things like prior authorizations. You will seek your treatment from the Medicare Advantage plan's network of providers whenever possible to keep your costs down. Remember, if you go outside the network, you may not have coverage, or you may have to pay higher out-of-network costs depending on the plan's network rules. When you join the plan, you will be given a summary of benefits that shows you all of the services covered and what your share of the cost of those services will be. Really be sure to review this carefully to see what you'll be expected to pay for things like lab work or hospital stays, surgeries, cancer treatments. Many Medicare Replacement plans also include a built-in Part D drug plan benefit, and some people enjoy being able to use one member ID card for hospital, outpatient, and drug needs. Something else to be aware of about Medicare Advantage is that the benefits will change from year to year. When you enroll in a plan, the premiums and cost sharing that you pay are only for that 1 year. In September, the plan will mail you an annual notice of change letter, and this letter will go over all the things that are changing inside the plan for the upcoming year. You may find that next year your premiums, your co-pays, or your co-insurance go up or down. Be aware also that providers in the network can drop from the network at any time during the year. If a provider that you are seeing leaves the network mid-year, you may not be able to see that provider again until you have a chance to switch plans during the next valid election period. The list of covered medications, called a drug formulary, can be changed from year to year as well, so you need to check annually that your plan will still cover your medications for the next year. If you read your annual notice of change and you find something that you're unhappy with any of the plan's changes for the upcoming year, you can make a change to a different Medicare Advantage plan offered in your county during the fall annual election period. You can also return to original Medicare if you prefer that and apply for a new Medigap plan, provided that you can answer no to the medical questions and pass the Medigap plan's medical underwriting. The annual election period does not give you a free pass into a Medigap plan without having to answer health questions, and this is one of the reasons that people work with brokers like us, so that when we accomplish your changes in the proper order, we make sure that you don't cancel one coverage before you've been approved with the new coverage, which of course is extremely important. One of the features that some beneficiaries like about Advantage plans also are the ancillary benefits. These plans can offer extra benefits for something that Medicare doesn't cover, such as routine dental, vision, or hearing services. And some plans may even offer free fitness memberships. These benefits are usually somewhat limited, and they're also subject to change, just as the regular benefits can change from year to year. Be sure to review the information about ancillary benefits that is included in the annual notice of change so that you'll be aware if any of these benefits are being decreased or dropped in the upcoming year. When you join a Medicare Advantage plan, you're generally locked in for the rest of the calendar year until the next annual election period rolls around on October 15th. There is also a separate Medicare Advantage open enrollment period just for Medicare Advantage plans that runs each year from January 1st to March 31st. During this window, people who are already enrolled in a Medicare Advantage plan can disenroll from that plan and return to original Medicare or switch to a different Medicare Advantage plan in the same county. Outside of that, you are usually required to stay in your plan through the end of the year. However, there may be certain circumstances that qualify for what we call a special election period to change plans mid-year, such as when you move out of state or you're no longer living in the network service area. That's what would create a special election period. Before enrolling in any Medicare Advantage plan, you'll want to research the plan's premiums, network, copays, insurance, deductibles, pharmacy network, and drug formulary. Check the plan's network directory to confirm that the most important providers are in the plan's network. Don't forget to check which hospitals you'll be able to use on the plan as well. Finally, confirm that the plan's formulary includes all of your most important medications. Do you have a question about Medicare Advantage plans? Drop it here in the comments and my team and I will answer. Now that you understand the terminology a little better, to learn more about the pros and cons of Medicare Advantage plans, check out this video, which is one of our most popular videos here on the Boomer Benefits YouTube channel. You can also sign up for our free 6-day Medicare email mini course to learn all about the options available to you for supplementing your Medicare benefits. Thanks for watching, and we'll see you in the next video.